Hi friends, today we will discuss about the oral cancer. Uh, First we will focus about on the oral cavity. The oral cavity includes the teeth, the gingiva above the teeth, which we also called as gums, the buccal mucosa. Below the behind the molar teeth there is a retromolar trigon. The floor of the mouth, the lips, the tongue, the anterior two-third of the tongue, the soft palate. Below the hard palate there is a soft palate. The oral cavity which we have discussed, the oral cancer can develop any part in that oral cavity. So there is the pre-malignant changes occur in those areas. So first one is the leukoplakia. The leukoplakia means the white patches occurs. So these white patches are generally painless, but they can easily scraped away. Means they can be taken for the examination. Second one is erythroplakia. These are the red patches. These are the most serious ones and maybe become malignant. And third is the erythroleukoplakia. These are the combination of white plus red patches. Now we will focus on the signs. The first one is the bad breath. Second one is the hoarseness of voice. The third one is the numbness in that region. The fourth one is the swelling in that area. The fifth one is the difficulty in chewing or swallowing. Difficulty in chewing or swallowing. Or the formation of lump or mass in that region. Now we will focus on the causes and the risk factors. Causes and the risk factors of the oral cancer. The first one is the tobacco chewing. In that, cigarette smoking, use of cigars, pipes can be included. The second one is the alcohol. Use of alcohol for a long time. The third one is the exposure to the sun. The fourth one is the human papilloma virus. Type 16. The fifth one is the age and sex, and last one is the unknown. Now we will focus on the diagnostic evaluations. The first one is the medical history and the physical examinations. In medical history, the history of head and neck cancer and the physical examination. Uh, second one. Second one is the lab test. Here, what the what they do the exfoliative cytology. In exfoliative cytology, the affected part is scraped away and sent for the examination. Different dyes are used so that they can detect the cancer is benign or the malignant. The third one is the X-ray or the imaging. In imaging, the mouth X-ray and CT scan, the PET scan and the PET scan. These are the diagnostic evaluations which we use to detect the oral cancer. Now we will focus on the management part. The first one is the surgery. Primary tumor resection is the first one. The maxillectomy, the mandible resection. In mandible resection, the mandible, the artificial mandible is implanted to to the mandible area. Radical neck dissection and the plastic surgery. In the plastic surgery, the flap means the part from the other areas. This may be PMMC flap taken and then they put over there. The second one is the radiation therapy. In radiation therapy, the radiations are given in those areas so that the tumor cannot spread to the further part. The third one is the chemotherapy.